emergency which can come up after MGB, which will be directly related to the gastric bypass, is ulcer. If you have ulcer, say down the line, 2, 3, 4 years down the line, you have a ulcer inside and it ruptures. In most of the cases, the incidence is very low. First of all, there will be a reason for this. If you have been smoking or taking painkillers for a long time, that is kind of burning the bypass inside, which is very fragile. So that can give a wound ulcer there. And if you don't treat that, it can get deeper and deeper, and ultimately the intestine can perforate, and that can be a sudden surgical emergency, and then you have to go to the hospital. Obviously, you will go to the hospital if you have pain and it's not getting relieved with normal medications. And then they will have to go in and fix that opening, you know. Still, when it's not all the times, it's not deadly, but it's dangerous. So to avoid that, what to do? Use curd regularly. And whenever you feel there is some upset here, you are not feeling comfortable, not even pain, sometimes you feel this area is not comfortable. Go to your doctor and tell him to do endoscopy.
Okay.
Have a look inside if there is any ulcer.
Okay.
Only one thing which you need to be careful about the surgery. Yeah. If you are comfortable, no problems, which like most of the patients will feel comfortable, then it's okay. Then you don't need to worry. We don't recommend endoscopy for every patient, but if someone is symptomatic, having problem, must get endoscopy to have a look inside. And other problems like having a clot, like now after surgery, we have given you these stockings. The reason is these stockings will keep your veins tight and will not let the blood pool down. And while traveling, when the patient is sitting for hours together, your blood will come down. See, normally also you have the swelling when you're traveling, swelling of the feet, because the blood is pooling down. And obese patients have thick blood. And the pooled down blood can get clotted inside the leg veins, and a particle of that clot can move up and get stuck into the lungs. That's called as pulmonary embolism, sudden breathlessness and collapse. So this is number one. Then number two is sleep apnea. Many patients have sleep apnea. Like in your case, we saw when you are sleeping, your oxygen goes down. And generally, we are not aware of this thing beforehand. I think even in your case, being young, you never went to the hospital for a sleep study. So, but when you sleep, your oxygen goes down. And we have learned this when you were admitted here. Because you are here for 3-4 days, and that's how we get to know while monitoring your oxygen when you're sleeping. And for that, we have given you the CPAP machine. CPAP means continuous positive airway pressure. Means it's just like a fan pushing air. No oxygen cylinder is connected to that. It's just your room air being pushed with some pressure inside. So that when you sleep, your tongue falls and there is some obstruction, and that's why we have snoring. And then the air can find room from the sides of the tongue because it's coming under high pressure. So you will get, your brain will get proper oxygen. So till the time your neck becomes thin, you should be using the CPAP, and that generally happens for 1 month. For 1 month, generally we recommend you should be having but still keep checking your oxygen levels. You have got the pulse oximeter. When she is sleeping, you should check how the oxygen is going, especially when she's in deep sleep. And that should be done like once or twice in one night. Around 1:30,
2 o'clock,
early morning, 2 o'clock, and then 4 o'clock. And that will give us a rough idea that how she's doing. But with CPAP, generally, patients are very safe. And we have already tested this thing here, putting you on CPAP, and we have monitored throughout the night. And we know that you maintain oxygen well with CPAP. So that's another thing, sleep apnea. So that is why, bariatric surgery sometimes is considered difficult because patients are difficult.
Each one is different.
If the surgery has not gone smooth, patient is vomiting, having other things like sleep apnea, so the scenario becomes a little bit complex. So that is why we say the surgery should be simple and smooth and should give you minimal pain and disturbance to the body, so that you can focus on the other problems. And once you become thin, then we are out from all these problems. Right?
Yes. Okay.